Hello, everyone. My name is Dr. Donaldson Conserve, and I'm an associate professor at the George Washington University. And I'm also the founder for the Black Male Professors and Researchers Collective. And today we have the pleasure of having Dr. Collins Airhihenbuwa as part of our Black Male Professors interview series. And I would like to pass it over to my colleague, Dr. Derek Griffith, to introduce himself.
Yes, good day all. Derek Griffith, a professor at Georgetown University in the Department of Health Management and Policy. I also co-direct the Racial Justice Institute and direct the Center for Men's Health Equity.
Dr. Collins Airhihenbuwa, if you would please also introduce yourself.
Hello, everyone. Collins Airhihenbuwa. I'm a professor in the Department of Health Policy and Behavioral Sciences and at the School of Public Health, Georgia State University in Atlanta.
Thank you very much, Dr. Airhihenbuwa. I'd like to just start by giving my gratitude to you, Dr. Airhihenbuwa, for all the years of mentorship since I was an undergraduate student. I remember reading one of your papers that really excited me about the field of public health, but also just personally as an immigrant who came from Haiti and going through the school system here. When I read your work, it spoke to my soul in the way you captured both your background from Nigeria and your experiences in America, and then tying all of that to public health. That was very fascinating and inspired me to want to come do my PhD in your department with you. So thank you so much for your work. And I'd like now to pass it over to Dr. Griffith to start us off.
Well, yeah, so today's conversation is going to be somewhat informal, and it really is just to hear your story, Dr. Airhihenbuwa. So I just want to also begin with my note of thanks and gratitude. I mean, I didn't have the opportunity to train under you directly, but through the work of colleagues of yours, colleagues of ours, Leonard Jack, through your kindness and generosity with me just over the years when I've needed an ear, you've certainly always been there. And even from the early parts of my career, engaging with Sophie and other things, you've been definitely very generous with just your time, and you really meant a lot to me as a scholar as well. So just wanted to start with that as well.
Well, first, let me thank both of you and for the work you are doing in this space. This is so important, and for your kind words. And we, as you know, we all occupy space and privilege of hoping to impact the next generation. That you have done it so tremendously well, and it's just a source of pride for me. Thank you to both of you for what you do, and also Dr. Airhihenbuwa, who is not with us, and for the commitment to this type of work.
Thank you, Dr. Airhihenbuwa. I appreciate it. All right, back to you, Dr. Griffith.
Yeah, so I'm not sure where you want to start, but what we want to get to is the way that and you correct me if I'm framing this in a way that is not the way that it makes sense for you, but so the way that I think about your scholarship and the impact that you've had on people, some people, their scholarship you can define pretty well by looking at the downstream impact on certain diseases, populations, or illnesses. There are other people who you define by, say, as one of my other mentors, Woody Neighbors, would say, on the independent variables. So racism, socioeconomic status, gender, something like that. You are one of the few that I can point to who really, your contribution is really more about how do we think about the process? How do we think about who we study, why we study them, and how we need to understand them better to be able to more effectively intervene to improve their health and well-being. And it has been applied clearly across any number of health issues through Penn 3 and just through your consultation work and so forth. So that's ultimately, if that is an accurate sort of characterization, I know that it's hard to summarize the length and body of work that you have, but that for me is sort of the, if I had to try to summarize it, that would be sort of the crux of what your contribution to the field has really been. Is that a fair, let me just stop by saying, is that a fair way to think about the way you think about your work?
Absolutely, and thank you for offering that summary and that perspective. And in reflecting back to how I started where I am now, if we mostly agree that everything we do comes down to a story, how we tell the story. And a part of what I've been focusing on is, what is the story about? And how do we understand the context of that story, who is telling it, and what is it designed to achieve? And so it's a different way of also capturing what you summarize. Is we are engaged in the craft of storytelling, whether it's in grant or paper. We are trying to tell the story. The question becomes, who is the story intended for? What is the story about, and how are we telling it?
Mm-hmm. So how, I guess we want to start, I don't want to start you in a crib, but how did you get to that point where this is what you thought was important for us to study? You know, I don't know if it was undergrad at Tennessee State, if it was, just, I mean, it could be earlier, but just where would you start with thinking that was such an important place to begin this conversation?
So I think, I mean, I was born in Nigeria, and I grew up in Nigeria, did my elementary school, early work, secondary school, we call high school here, and worked for a couple of years before coming to the US. And of course, landed at Tennessee State University and HBCU, and with a very clear mission of offering what I would come to appreciate very much later, a different part of what has become my identity. And so I describe myself now as an African rooted in the Edo culture of Nigeria, and an American anchored in contemporary African-American experience. So this would take years later to define and frame myself in that way. But it started, I think the realization of where it began to crystallize for me was in graduate school. Is maybe because not realizing it at the time, growing up in a village where there was so much present, and there was different level of decision making with my parents and how to make decisions where our livelihood was not really dependent on having a job, because they were both farmers, and we grew up on our land and grew our crops. So of course, the goal for every young person was to get an education or training and work for the government, work for the ministries and all that. And so you sort of envy those whose life will put them on that path to work for different level government. And of course, left Nigeria, came to Tennessee State, and being exposed to a different way of understanding social engagement. We weren't talking about racism much then, but there was something that we were learning about, even when we point to landmark decision. There are ways it impacted Black community that I would not learn in other institutions. For example, the Flexner report is being credited for streamlining medical education to the level it is now, but you don't often hear about how it actually eliminated all medical school and only Meharry and how it survived. And it was later on that Morehouse and
Drew.
the
Charles Drew.
Charles Drew was later established. But that impact, the same applies to closure of hospital. So at Tennessee State, it started to understand, not just through medicine in terms of even literature, this storytelling, when it's told from the perspective of those who've been thrown to the margin, consigned to the margin. So all of that is accumulating. And then I end up in graduate school, University of Tennessee. And of course, in public health, we focus on disease and we want to identify what the problems are and come up with solutions. But anytime we talk about the population that I consider where I was rooted, it was always from a deficit of what wasn't there. It wasn't just so much of what disease burden there was. It was also the story that is connected to those who occupy those spaces, like my parents, as people for whom education was needed. So we need to develop intervention to educate them about what behavior will prevent XYZ. It was as though they had nothing to offer. And then start to consider, but I grew up in a space that was very rich with decision making. And it started to read beyond public health. And later on, the work in the discipline that will include critical in their title started to emerge. Whether it's in communication or history, that we needed to critically examine some of those issues. But it was in graduate school that I first realized that those who were teaching this deficit model, what is missing, and never focusing on the strength, what is there, are not necessarily bad people. They are reproducing what they learn and trying to impact it on others. And so if the story has to change, I had to start thinking about a different way of framing the story, that there has to be a different way of moving from cultural barrier to cultural strength. Because anytime culture was brought up, it was always about a barrier. And I said, what about cultural strength? But of course, I didn't have the tools to do any of that. And as I've said to many in the group that I've had privilege of speaking with, that if you are in the process of training, it's very important to do what you have to do before you get to do what you want to do. You can't simply say because what you want to do is not there, you're not going to do what you have to do. A part of what I had to do was actually to begin to also understand the cultural logic of what we currently use in the theories and model, and where people may even disagree, that to sort of move into why is story framed, why are stories framed this way, what reinforces them, and how are they being retold. So that was how it started. It started in graduate school, the idea starting to percolate, and I still remember doing my dissertation. I was interested in traditional healing, what I consider heads of household make decisions about health. So I went to, again, my village and the what we call the local government areas that were the equivalent of a county here, to get information. At the time, my older brother was working for the government. So we'll go from house to house in different villages, collecting data. And I'll go there and I'll ask for who the head of household is. I remember the two incidents that got me to think and start thinking about this whole idea, even story, when it's told amongst ourselves. There was one incident where somebody noticed it was a government vehicle. The license plates are always different. and ask me question about my brother or my family, and I talked about it, say, where are you from? Say, from such and such village, Tofure village. And who are your parents? I said, my father is so and so. Oh, why didn't you say so before? Yeah, sit down and we'll talk to you. So the power of that connection. So I'm asking them to share information. They don't know anything about me. They had to authenticate who I am, tied to somebody that they believe is trustworthy for them to engage me. So that was initially first point I noted. The second was when I would ask question about who make the decision about whether or not to use traditional healing or to go to the hospital. My assumption, of course, now I'm trained in the Western way of knowing because I'm now top notch, and I know everything. So I'm focusing on the husband. And every time I'm asking, because sometimes the husband will look at the wife and she will murmur something and then he will repeat it. And I say, okay, yeah, this sounds familiar. So when I was growing up, if you wanted to know who was making decision about my sickness, my father is not who you will be talking to. You'll be asking my mother. But head of household, because of the way it's structured, got me to focusing on the men when, in fact, I even was in a household where call on a child, where is your mother? I said, the mother is not at home right now. They said, oh, okay. Well, I don't know how to answer that question. So I said, okay. Even though I'm doing what I have to do, I still have to do all the analysis, publishing it. Then it became clear to me that the story of decision-making framed in a way that suggests these people have no cultural logic, and that in this decision, patriarchy rules, that somehow is the man that is the head of the household, that the notion of head of household was actually misguided, even in that work. So these were all the experience put together that led me to start thinking something needed to be done, so that after I graduated and started my work, I started thinking differently about how to reframe the story.
Thank you very much for that wonderful story, Dr. Mbua. And there are so many interesting points I would like to follow up on. And one is, especially for the purpose of the platform, the Black Male Professors and Researchers Collective platform, I would like to start by asking if you can share the journey now from graduating with your PhD to eventually securing a professor position, right? What was that journey like? And then within that journey, how long did you continue having to do what you have to do until you could do what you want to do, whether it was before the professorship and then eventually doing the professorship?
Right. So I think I'm of a generation where it was okay not to know everything you need to know. And I talk about this when I talk about different groups. I would say it's not fair of me or someone of my generation to impose certain framework, way of knowing on the current day. We're in a different time. At my time, the process of getting to answering some of those intractable questions was almost something you did along the side of following the conventional route that you are supposed to take. So after graduation, my first position was at Penn State, and my first 2 years, I was asked to teach first aid and emergency care. And the course was the largest in the department, was the Department of Health Education. And I still keep in mind, I'm observing all these ways that what I'm experiencing is not actually reflected in what I'm learning, but I'm learning something new, and there was something there. So I'm teaching first aid and emergency care, and the book we were using was American Red Cross book. And two very important information that caused me to question how the story was framed. One was description of when you go into shock. When you go into shock, your body starts turning blue. And so I look at my skin and say, body starts turning blue. And then they asked how to stop myself. I said, but if you're a Black person, your body will not turn blue. Your lips or your fingernail might turn. So there ought to be a different landmark of describing this, because the people who came up with those important landmarks to use for determining somebody who goes into shock were only thinking about what was normal within their own context, and that is the white identity, the color of the skin. And so I started talking about different landmarks that we need to think about. But alongside of that, I started to question, why do we have this color banded? And why is this skin color banded? I don't know if you can see it.
Yes.
So why is this? So I started the white skin color banded. Said these are ways. Now we're talking about, if you look at the global majority embracing this, the therapeutic benefit may be the same, but it would take 2 or 3 years ago for me to see this skin color banded. And so imagine I started on the faculty in 1984. It would take this long for me to see a different skin color banded. So you have African countries that you probably will not see this skin color banded in those countries. So it's a way of causing me to really begin to examine, how do we reframe the story in a way that what was thought to be universal is actually understood to be cultural and is responsive to a certain way of knowing that is not necessarily universal. And so the learning what you have to learn is also important to begin to not necessarily discount what is there, but to put it in its proper frame. That it doesn't apply to me doesn't mean it may not apply. It simply means it doesn't apply to me. It goes to what Chinua Achebe would say, when one thing stands, another thing must stand beside it. So that became this notion of understanding the alternative way of doing things. We say it's alternative, but in some context, it's not the alternative. The main way of doing things, the new way, is the alternative. So as you go through the rank, through assistant professor, I started writing about culture. And even when I faced pushback in the review process, in fact, when I was going off for promotion and tenure, I started applying to other institutions because I had received feedback in my 4th year that the work I'm doing on culture is not one that resonates with the profession. Why am I focusing on culture? That is what anthropologists do. But I believe that culture is very central to how we are framing these stories, and that was the path that I was going to take. And luckily, I went through, or fortunately, and through just persistence, I went through that process within the department. But understanding this notion of duality actually framed the way I approach issue, that I tended to be more accommodating of alternative view, but seeing it as alternative. So what some will consider mainstream, to me, will be alternative, because I come from a culture, a context where the way of doing things also work. And so my study of foray into the critical became even more important. That I started reading far and wide beyond the profession, reading the work in education from Stuart Hall and to Henry Giroux in education, Paulo Freire, and then started also going back into literature, reading the work of the Wole Soyinka, Chinua Achebe, Ben Okri, and then within this country, the work of Toni Morrison become James Baldwin, as a way of understanding why storytelling is important, the resistance that one faces. But I think because of that, there was, when I was an associate professor, and it was time to appoint a new department chair in health education, I was surprised when the dean called me in and said, your colleague would like you to be the chair. We had 3 full professors in the department, all white, and I didn't understand why, and that is what the majority has asked, because the dean was calling faculty member to come in and identify who they like to lead them. And then, of course, health ed was already slated to be phased out. I worked on it and we moved into a department of biobehavioral health that was created. But I was steadfast in my belief. At this time, Pen 3 model is already been published. It was published in 1989 because I wanted to come up with a different framework of telling the story whereby, as I will later argue, that anytime you are engaging community, you have to always begin with the positive. If you cannot find something positive, you have to get out or you become a part of the problem. That became a sort of a hallmark of what Pen 3 model was, that you need to identify the positive. Because of those experiences in graduate school where the strength of my parents were never really part of the story, it was what was missing, not what was there that I saw. And that people are not defined by the disease that they have. They are defined by the totality of what is there, the humanity within the space. And that because even though we bemoan our heavy reliance on clinical model, we often don't know how to extricate ourselves from it in public health. We still want to base all our training on disease outcome, and that doesn't really get us to where we want to be. So the Pen 3 model was developed basically to offer a framework that says you have to truly engage community and understand what their priorities are and what the issues are before you come up with your own idea of what you think needs to be happening. So that belief in that there is no single truth, that there are multiple truths, that there is no single perspective, there are multiple perspectives, whether it's in understanding the limited number of medical schools for Blacks, or understanding why literary giant took the position to first start advancing decolonization the way we didn't understand, by telling the story that reflect the strength within their space, or just the normal way of people engaging. And so that is what kept me going up to even biobehavioral health, when the term of my predecessor ended, and I was actually in South Africa when the dean called me and said, the same event that happened in health education happened in biobehavioral health, that your colleagues have come to me, and there was always an exception of 1 or 2 persons, and that says, we'd like you to be a department chair. And I said, okay. And that was how, that is believing in what you believe in, but not stop studying what has been there so that you know how to offer the nature of the level of critique that will be necessary to ensure that you're not just saying dismiss it. You understand it, but you're saying that it's not global, it's not relevant to certain context.
Wow, wow, wow. Thank you. Thank you. There's a lot to digest there, but I'll let Dr. Griffith ask a question since.
Yeah, no, I want to build from that. And it's striking that you built your career, if I'm understanding this right, on bringing knowledge, literature, ways of knowing from other fields into public health. Whereas usually we're taught to sort of build more incrementally from within the field, but you found that was, you needed this other perspective to that was important for you. So if you can just say a little bit more about that and how, because I'm struck by not just, it wasn't even necessarily social scientists that you were reading. You're reading more from the humanities, reading, yeah. So talk a bit about more about that.
Right. So when I really got into studying culture, culture cannot be understood from the standpoint of a disease. And what I've often said is that if you go to a country and whether it's a study abroad, whatever the global experience is, and you visit a hospital, if your assignment is solely at a clinic where people are really vulnerable, you go to a clinic because you're sick, you can't really say much about the culture of the society. You just saw what happened when you are in a clinic. And the same thing can happen. You come to Atlanta and you go to Grady Hospital, you can spend a month if you want, but you cannot talk about Atlantans or Georgians based on what you saw there. It struck me that even when we provide opportunity for students, we tend to prioritize going to a place where students start to see themselves as going to help somebody, even when because you have all this medical brigade, all this clinical intervention, and still goes on. It isn't that it is wrong. It is that it could be misleading for students who think that they have actually gone there and understood the culture. There is nothing more powerful than being in a context that is outside of your own and being able to truly observe how people make connection, how they engage. So a part of how you learn about this is just reading, whether it's literature or critical essay, work from other fields, philosophy, history. So Derek Bell's work was very important and, to me because when I first read Faces at the Bottom of the Well, I had already, keep in mind I went to an HBCU and I've also understood how at the University of Tennessee, great professors that I had, but focusing on the negative. Now I'm on the end of trying to fill the gap that I felt were there. And I know that I had to go outside of this usual source of knowledge. And so when I would teach a course in global health, I will, in fact, I had actually forgotten some of this, and Chandra Ford and I were doing a training recently, and she reminded me of, actually sent me the compiled reading I used to have for students. It was always required that you read a book, a fiction, as a part of the course. And Derek Bell's work, Faces at the Bottom of the Well, was a required reading. And there was a time that I also required if it's not for everybody, but some student, Astonishing the Gods by Ben Okri, where if it is just mind-blowing when I first read it. I still remember a passage that talks about to imagine a library where you just don't go and withdraw knowledge, you're actually going there to deposit knowledge. I thought that was crazy. It's a totally different way of thinking. Oh, yeah. So in all this reading, what also occurred to me is that in coming up with a different story, you have to start reimagining the language, that language often fails us. If I, and then we have some student resource of Black folks when you talk about Du Bois' two-ness, but the historian Dolly Clark Hines talked about the five-ness even before we all embrace the popularity of intersectionality. She's talked about for an African-American woman, the identity goes beyond Black and white. Is the gender component and the socioeconomic component that leads to the fiveness that we have to consider. And then you pulling all that together, you begin to realize that what we consider education is really not education, it's training and schooling. That you are schooled and lettered doesn't mean you are educated. And because there are many people who are schooled and lettered, which means you are well credentialed, but lack the education, if that is the ultimate goal for making decisions. And this really came to a broader realization under COVID-19, that medical doctor and people with doctoral degree were just as oppositional to COVID-19 as people who didn't go to school. So there was no degree boundaries. If we are trying to understand why people make decisions using the three classical SES measure, income, education, and profession, that it wouldn't matter where you are on that. People fall on all sides. And that when you also compare countries, actually, democratic countries perform far worse than non-democratic countries. And then were democratic countries who performed well, they were led by women, most of them. And then we are now understanding this today, but at that time, it was clear that the language, which is why emphasizing cultural strength became important, that if we have to couple a word with culture, it shouldn't always be barrier, it should be strength. And I would need to begin to look at what is unique. And even when something is negative, is it at the individual level or at the structural level? So reading in education, the work of Paulo Freire, so instrumental in my own process of engaging a broader way of understanding this language. Wole Soyinka's work, Death and the King's Horseman, the idea that for somebody, Death and the King's Horseman is this play about the king's horseman who decided to commit death as a part of cultural belief that when the king dies, you have to follow the king to smooth the passage to the world beyond. So what they have to do conventionally is called suicide, but Soyinka called it committing death. And then the song came from overseas to basically, well, the missionary heard about this and said, you cannot commit suicide. We're going to stop you from doing this. And that whole issue of how do we understand practices that occur in under context when a ship is going down and the captain goes down with the ship, with the property, is heroism. And when the king goes down, the king's horseman is trying to go down with the king, is barbaric. So it would depend on the cultural perspective to truly understand that. So the song coming from Europe was basically saying that the entire life of the King's Osman was actually prepared for that path. Not being able to engage it is basically living, it's not living. So, and for us in the contemporary time where that is not practiced, it seems odd and totally strange, but that was the nature of it. So reading all that type of work and Ben Okri's work, Astonishing the Gods, and just trying to understand how do we make sense out of what we teach from a particular culture, particularly when that perspective is no longer a part of what is being valued. So I knew I needed to read more and more. Paulo Freire's and the question of what matters in education, because of the emphasis in adult education, is not really what knowledge you impact, is the degree to which that knowledge applies to what the individual can engage in on a daily basis. You can teach, you want to teach a carpenter literacy, well, base it on nails and hammer and wood, don't teach abstract knowledge. And we know that when we teach students about computer usage or statistics, if you graduate and you're not using that school, it's wasted, it's gone. And but we don't think about those things. But when we go into a community, we develop this literacy program that is designed to focus on a particular issue of what is missing. It's not connected to what is there. And then years later, we come back and say, well, the thing wasn't sustainable. But no, it's because it wasn't connected to what is there. It wasn't connected to their livelihood. And all that I have to pull on to begin to, even now continuously, to pull on, so that years later when Chandra Ford asked me after we've been broaching this idea of how do we frame the idea that Derek Bell and others were advancing in law, in critical race theory, reframing in public health. So you've been talking about this since you were undergraduate and graduate student. Let's work on this, and it led to that 2010 publication of public health, critical race praxis. But it's again drawing from other field to say, if we are going to understand health equity and public health, we need to really draw on the story about people more so than the condition that circumscribe or circumscribe their context or makes them vulnerable to certain conditions. That the story has to be very much revisited. How are we telling the story?
All right. Well, I'm very interested in the story that we have not heard as much about in the sense of being a professor. So there's the scholarship that we are very well aware of, and you have provided books that I think people in public health now can read, and hopefully they will still read outside of public health, but if they get to read your work, then they have a chance to learn about these different perspectives that were inspired by these other books that you read. I'm curious to learn a little bit more about how you navigated academia during the time when there would have been fewer Black men or Black academics to begin with, from a PhD program into a professorship, being the chair. If you could share us a little bit about your journey in terms of the resistance you face, struggles, and then successes as well, which you've already touched upon a bit, but navigating that space in academia. I know, for example, I started this Black Male Professors and Researchers Collective because I was the only one. I was the only Black male PhD student in the program. Eventually, the only Black male professor. So I wanted to create community. So how did you tap into community during that early phase of your journey, and then now as a professor at Georgia State University?
Yeah, that You know, you went to Penn State. You know, Penn State is located, it's a college town. And we say we're equally inaccessible from all directions. So when you are in an environment like that, you're almost forced to create a community. Because when I was a faculty member at Penn State, earlier on, there were no Black barber. I still remember going to the dorm for a young man to cut my hair because that was how he was making his side money, doing his side gig, and a student. So what really helped me was that I was very fortunate to be there at a time where there were other faculty members, male faculty members in different disciplines who felt the need to come together and created a forum on Black affairs. It was initially it was for faculty, staff, and students. Then the student group decided to break off and form their own group because there was enough Black students to form their own group. And the Forum Black Affairs created a space to actually first bond as faculty and then begin to critically examine the way in which the policy of the institution made it challenging for Black to thrive in that environment. Whether it's in the heavy load borne by faculty, because whether you are appointed or not, you became the default mentor for all the minoritized student and in some cases staff and faculty. In fact, my first appointment, 25% of my time was as assistant to the Dean for Minority Affairs, it was called at the time. And my primary responsibility was to focus on recruiting undergraduate students, Black undergraduate students, specifically. If we're able to get Latin student, it was fine, but the focus was on Black students. And it turns out that all other Black faculty who were there at the time, whether they were African American, Caribbean, or African, had some part of that responsibility, whether it was official or unofficial. So we had the Forum on Black Affairs, and it gave us a platform. At one point, I was the president, and I actually called to issue a Black paper. That was in 1987. And it was really, we call it the Black paper, and called the administration to task for not doing enough to, today we would say, visibilize the work of Blacks and hire more Black faculty, which remains the same. And 6 months after our paper, the student took over communication building and their demand was met. And because all we could do as faculty, you try to raise some issue, but students were also very much active on their own in engaging and coming together and saying, we need to do more. But outside of that, we also created what we call the Talented Tent Investment Club. Now, some of our sisters were mad at us because initially Talented Tent, and that's from after W.B. Du Bois' notion of the talented tent. But it was an investment club. What it really was a fellowship for us to have a space to nurture ourselves as family members, people with connection, with shared kindred spirit and all of that. I say that because it was supposed to be an investment club. We do contribute money, but I don't think after the years that many of us were in that investment club, we actually learned about investment. We rely heavily on Jim Stewart, who was a mentor to me and chair of Black Studies program at the time, and was very instrumental in really pulling together Black faculty. And we use Black commonly there to, there's an African American, African, the Caribbean, everyone coming together to really build connection. But it also did additional thing for me because you have someone like Harold Cheatham who was writing in counseling psychology some of the same issue. James Stewart addresses some of the same issue in labor law, the issue of to be inclusive and how Blacks and other minority at the time were left out of decision making because they were just not being hired or not enough being trained at our institution. So it did create a nurturing space. The investment club was a rotation, was something we all look forward to. We take turn and meet in each other's house. Thereby, you know everybody's family. You can bring whatever little dish you but the host serve all the dishes. But it was so reinforcing that we all look forward to it. Whereas the Forum on Black Affairs was more official. It met on campus at the Port Robeson Cultural Center initially, and then we moved to other side. And the director of Port Robeson Cultural Center, the late Larry Young, was also very instrumental in. So there were a number of people doing different things to reinforce some of the things that I was interested in. My earlier writings, Jim Stewart was the one that we edited. Even some of my earlier publication went to studies, Journal of Black Studies, because Public Health Journal did not necessarily see this as something that was of interest. So you sort of have to find a different way to express those ideas and before it came into the mainstream. And I wasn't alone because there were others, like I said, either within the forum or within our investment club that I could lean on. When I got my review back, I was the only Black in the health education department in biobehavioral health. I think Keith Whitfield and I, and then Gary King joined us later, were the Blacks there. But earlier on, you know you had to rely on faculty members from other departments because folks weren't there. And those who were there did not understand what I was writing. Even when they were supportive, I think the chair before me in health education was very supportive, but he didn't know much about this area. St. Pierre. So a part of what we had to do to negotiate was build your community. And I said this was helpful at Penn State because I tried to replicate this when I moved on to, and then of course I became a department chair of biobehavioral health. It was easier to make connection and extend some of it because before you, Dr. Conserve and others, Iwelu Moore and others joined, and who are now doing incredibly well, Wemboloa, and were in that mix. But moving on, and I think within biobehavioral health, if you recall, when we do a journal club, some of you will even invite students from outside of biobehavioral health. It was because I knew as a faculty what it meant to draw on the just the intellectual wealth of others who are outside the field. So I find it quite nourishing to have that going on. So moving on to become dean at St. Louis University, that was two things. I wanted to see how we replicate that experience at Penn State. It just was not possible. It's an urban university, which is what I also find out here in Atlanta. Urban university, by 4:30, most people are gone home. And because people tend to live in suburban area. And the effort to try and have something going on just wasn't yielding the same outcome. So it was much more difficult. But I didn't stay in St. Louis long enough. So I had already started with two individuals who both passed on now, actually, to really look at two Black men, how we try to look at the lesson of Ferguson, for example, and begin to build a network of folks beyond St. Louis University. I think Keon was very much interested in this, and he actually organized Keon Gilbert, who he actually organized a meeting that involved Black faculty, not just from St. Louis, from WashU, from AMSO, to begin that process. But I didn't stay long enough, and I think he understood the value of that and why it's important to go beyond your institutional boundary to build that network. You need that. And coming to Georgia State, another urban institution that I'm finding out that the location matter in different way. There's so much in the city that you can draw on, and that is good. But there's also a need from within the institution to build that network, because there are particular milestone and goal that the institution demand of you that is helpful to know how to navigate, or by talking and having conversation with others who've gone through it. So that is important. I think I was fortunate coming through Penn State to have gone through that experience. And the other part is a work in progress. I continue to meet with, we have affinity group, which for me is somewhat different from my experience at Penn State. The affinity group came about here as a part of the university supporting the creation of an affinity group. Whereas at Penn State, our group was very organic. In fact, when provost at one time wanted to be a part of it, there are times where we were resistant to provost becoming a member, because it's a membership organization, a Forum on Black Affairs. And it has to be very clear that some of the things that we're talking about may very well be a direct challenge to the office of the provost and the president. And provost at the time was agreeable. So it also depends on how that organization come to be, in terms of the level of investment. The investment club was very organic. It was strictly something we created and for us by us. Yeah.
Wow. I'm reminded of the fact that 2 weeks ago or so, I reached out to Dr. Griffith because we live in the same vicinity, Washington, D.C., Arlington, Virginia. And I remember in the email, I mentioned that we have lived here for, I think, over about 2 years now, 2 years, close to 3 years. And we hadn't had a chance to meet. And I said, enough is enough. We have to meet.
Yeah.
We talk on the phone, we talk on the Zoom, but we have to meet for tea because of that importance for community. Right. And I expressed to him how I miss the community at Penn State, where we were gathering weekly with each other as students, or at your house that you opened up for us. And it's not something that we may have appreciated as much when we had it. But now that we have left Penn State and your presence, not being around, I believe, if I was in the same city, as you know, I would definitely be tracking you down and trying to engage in one way or another. But that sense of community, whether we have to create it or nurture it, I think is very important. And I'm very grateful, Dr. Griffith responded, and we're hoping to meet some more. And I'm going to pass it back to you, Dr. Griffith, as we get ready to wrap up for any more comments or questions.
I think as you are passing it on, what I would say is that for anyone listening, making that connection is very important. I know when I raised it here with a couple of 3 senior faculty, and we agree, but I know a comment one person made is that we can make it bigger and get other people involved in. I remember saying, if you wait to make it bigger, you're not going to get to where you're going to get to. Start with whoever is there, even if it's just 3 people, and begin to add people. The Penn State experience worked well because we made ourselves available to colleges to say, if you have someone new coming in on the faculty, we are here. There are times where some of them will interview with us. And if we know a new person is in town, we'll make effort to somebody to invite them to lunch and just say what we have to offer. So start small, don't wait till you get everybody involved. Somebody may eventually complain that they weren't included. Just apologize and say it wasn't intended to exclude, and start with, it can be every 2 months or every 3 months, better than not having something.
Thank you. Thank you. Go ahead, Dr. Griffith.
No, so the last question I have is, well, it's a comment and a question, and I think you've seen it in this last part of the discussion. The other legacy that I see of your work, in addition to Pen 3 and the impact that it's had on the field, is really your impact as a mentor. And just I mean, the tree that, that you are the root of, or one of the main roots of, and how many people, particularly Black scholars, who have flourished in the academy, that you have produced out of Penn State during your time, and that you've influenced who were not necessarily your students. Yeah, I see your most recent book over your shoulder there, and it features a lot of folks, both who were students of yours, as well as just folks who your work has really shaped not just their scholarship, but in the book they talk about how it affects their lives and how they approach different aspects of their lives beyond even use Pen 3 as almost a planning model for themselves, not just in terms of their work. So I just want to hear you talk a little bit about it. I guess it sounds intentional, just as I'm hearing you describe this. This was not an accident that you just happened to be able to recruit all these folks from various places to this place that is equally inaccessible from everywhere. But yeah, just talk to me about the mentoring and why that has been such an important part of you, because you see not just sort of you, but how you can see that these were your students, or that you influence people, like even if they don't know that initially, there's a signature of the way that you critically, your students have a critical lens that others just simply don't. For me, I mean, you can literally see people who are your students, and because you kind of see what their scholarship is, it won't be a surprise that they will see the connection to you. So I guess I don't know where the question is buried in there, but I'm just curious, like, how do you think about this? Because clearly this has been something you did very deliberately.
Right. Well, thank you for that, and thank you for the very generous comment on the book, actually. And Donaldson and Lucien were also contributor in the book. That is something that you really don't always know what the outcome is. To me, a part of mentoring for me is a responsibility. I come from a culture in which you are in a particular position. It's not even something you need to be reminded of, that you have a responsibility to do something for those coming after you by sometimes removing the obstacle, other times living, if you can, certain challenges because there are lessons that come through there. It could be a meeting with people. I want to talk to this person. I want to have this person engage me. Say, yeah, go ahead. Even though the challenge might be there, but you have to prepare that they come back to you to provide the support that they need. What they say that smooth seas do not make skillful sailors. You want part of growth is to face certain challenges, whether you intend to or not, but be prepared to support those that are coming under you. And I think there's an ideal expression that your children becoming greater than you is a blessing. That is a part of what you hope for. It shouldn't just be doing what you're doing, but they chart their own path and they are able to do what constitutes life fulfillment for them. And I appreciate you noting the critical lens they have in addressing issues of the world. I thrive in the environment of Black scholars, although not exclusively. All the students that I mentor cut across different group at Penn State. But because of the particular work that I do on culture, and when I think my mentees who become my mentor now in terms of taking leadership in different respects where I'm following, what they understand is that the work that we do does not need to be divorced from who we are. So when I ask the question, do you know who you are without what you do? And before I even started asking the question, I see that my former students are taking that to heart, where the part of who they are, it doesn't matter whether there are challenges or no challenges, but that is a part of what you begin to engage in. That if you are engaging community, always remember who you are, that it is not the credential, it is not the letter, it's not the degree. There is something much more deeper and much more organic that connect us. I think to the extent that we can remember that and let it cut through what we do, and then we are able to make hopefully the type of contribution that matter, that can outlive our experience. After all, we'll go through this experience, and what do we leave behind? It's really the idea of what you hopefully have impacted on those who are taking the message and the story beyond where you're able to live it. So I'm very proud of everyone who's come across my path, or whose path I've come across, and for you too, Derek, in terms of our interaction and the work that you are doing in men's health. Before this space was created, it was one of the earlier ones who really been very intentional in looking at how do we understand the health of men, the impact of what society structure and how we engage one another. And I think this is it's all a part of that legacy and continuation. And I applaud you and Donaldson and Lucien for doing this work. And it's been a pleasure. And I will keep doing it for as long as I can. As long as I feel I have something to contribute.
You always will. And you should know that that work and the approach that I took and have taken is based on Pen 3. It's written into the very first grant that I ever got from NIH. It's written into the way that I approached it, why I ended up using qualitative research to understand the way that men understood those things. Pen 3 was the foundation of that. So it was really instrumental to connect those pieces. Yeah.
Thank you. Thank you so much. That was very humbling.
I have no words, but I know we have to end, and there's so many more questions we can ask you, but I think that was a very good way to finish. And I want to say thank you again, not only for your mentorship, but for helping the many of us to be reminded to bring who we are to the work that we do, and not feeling like it has to be one or the other. And I say this because I know before I read your work, when I was an undergraduate student, that's how I used to feel. There was school, and then there was my life outside of school. And when I read your work, to be able to see that I am part of this journey, of this academic journey, that it's not just a matter of studying to get good grades, but to critically engage with myself and my community, and over time to ending up at Penn State. I don't share this to too many individuals, but I only applied to one PhD program because it was not just about going for a PhD. It was about going to a place where I knew I could be nurtured in a way that another PhD program wouldn't have been able to provide. So I needed not just the academic, but that personal touch that you were able to provide with Dr. Gary King and the wider community that I found at Penn State that was so enriching and inspiring, till this day. So thank you. And thank you as well, Dr. Griffith. And we hope whoever is listening enjoy this wonderful session.
Thank you all.
Thank you.
Oh,